Hello, my name is Dr. Dewan as Raja. Today I will discuss about African trypanosomiasis, also called sleeping sickness. It is caused by two protozoan parasites. One is Trypanosoma brucei rhodesians, and this sleeping sickness happens in the eastern and southeastern part of the Africa continent. Another type is the protozoa is the Trypanosoma brucei gambians, and this happens in the central and west Africa. Sleeping sickness is transmitted through the bite of tsetse fly. Tsetse fly is a large fly, maybe 0.2 to 0.6 inches in length. Okay, so and its bite is certainly painful. Trypanosoma brucei gambians account for 98% of the cases. So most of the diseases are occurring on the West Africa and the Central Africa. It does not happen in Asia. So this is an African disease. This happen in the Central and West Africa, most of the cases. 2% cases happen in the Eastern and Southeastern Africa. Okay. Tsetse fly inhabit rural, densely vegetated area. Tsetse fly bite during the day and the infection rate is less than 1%. So if a person is exposed to tsetse fly or tsetse fly or tsetse fly, different type of pronunciation. Okay, so if he is exposed to that fly, if you get repeated bite from the tsetse fly, then he will have more chance to get the African trypanosomiasis. Okay. So here is the tsetse fly, here is the blood smear showing the protozoa. This is the trypomestigate of Trypanoma brucei species. Another one is here, another one is here. This is the blood cell, this is the RBCs. Okay, and this is the parasite, the protozoa. Okay, this is the life cycle, biological cycle of the disease and the host, related host. Okay, if we start from here, if I take a blood meal, inject metacyclic trypanomestigate, okay, then these changes happen. Okay, then tsetse fly takes a blood meal, bloodstream trypanomestigate are ingested. Okay, it continues like that way. So epimestigate multiply in salivary gland. This transform into metacyclic trypoma mestigates. Okay, so the life cycle, you can go through that part, and everything is self-explanatory. And the reservoir is not only human, it may be cattle, it may be antelope or other animals. Okay, here is the line of demarcation. This is the Trypanosomia brucei gambians here. Okay, here is the rhodesians. Gambians is here. Okay, here Uganda we have both. The northern part Trypanosoma brucei gambians. The southern part it is the Trypanosoma brucei rhodesians. So this Uganda has two parts, north part, south part. North part is the Trypanosoma brucei gambians. The south part, the most of the part, is the Trypanosoma brucei rhodesians. Okay, so these are the less common area, 2% of the all prevalence. Here is around 98% of the cases belong to this group, and that is on the Central Africa, like part of Sudan. Okay, and the sub-Saharan country, other countries here. Okay, so this is the map. This is the site of protozoa Trypanoma brucei gambians. This is the site of protozoa, Trypanoma brucei rhodescens. But in Africa, northern part, Trypanoma brucei gambians. The southern part, Trypanoma brucei rhodescens. Okay, we got that. Okay, now Trypanoma brucei rhodescens. What are the signs symptoms? Appear 1 to 3 weeks of infectious bite, and include high fever, chancre in the white side, skin rash, headache, myalgia, and thrombocytopenia. There may be splenomegaly, that is the enlargement of the spleen, kidney failure, and cardiac dysfunction due to Trypanoma brucei rhodescens. Okay, so here Trypanoma brucei gambians. CNS involvement occurs within a month and results in sleep disturbance, mental deterioration, and ultimately death. Here, Trypanoma brucei gambians, here clinical manifestation appear months to years. Signs symptoms include intermittent fever, headache, myalgia, arthalgia, that is pain in the joint, facial edema, pruritus, itching, lymphadenopathy, and weight loss. CNS involvement is characterized by daytime somnolence, nighttime sleeplessness, severe headache, mood and behavioral change, focal deficits, and endocrine problem. So this is Gambians. This is for the western part of the Africa, central part of the Africa. Okay. CNS involvement is characterized by daytime somnolence, nighttime sleeplessness, sleep disturbance, severe headache, mood and behavioral change, focal deficit, endocrine problem. Less severe than the other type. That is, this is Gambians is less severe than that of the Trypanoma brucei rhodescens. Okay, this is less severe, but outcome is almost same. Death in both cases. Okay, fatal in the long run. We got that. So Trypanoma brucei rhodescens on the eastern side, southern side of the Africa, continental Africa. Trypanoma brucei gambians, that is in the central Africa and also the eastern part of the Africa, sub-Saharan countries of eastern side.